Good morning. My name is Joe Benz. I am State Director for Protect Our Care. The Fifth Circuit yesterday ruled on the Texas lawsuit regarding the constitutionality of the Affordable Care Act. Two Republican-appointed judges on the court sided with President Trump and Republicans to declare the individual mandate portion of the act unconstitutional. They then remanded the case to the same handpicked lower court judge whose opinion is that the entire Affordable Care Act is unconstitutional. Georgia's health care, especially Georgians with pre-existing conditions, has never been in greater jeopardy. Yesterday's decision brings Attorney General Chris Carr and Republicans' lawsuit one step closer to ripping health care coverage away from hundreds of thousands of Georgians and threatening the care of over 4 million Georgians with pre-existing conditions. We are here today with Georgians across the spectrum of experience with the healthcare system to discuss this disastrous court decision and what it means for the health and well-being of Georgians. And we're going to start out with Representative David Dreyer. He's an attorney, a state representative for House District 59. He founded Dreyer Sterling, and he represents individuals and companies in courts throughout the state. Representative Dreyer has been a consistent advocate for bridging the Medicaid gap and providing health care access to all Georgians.
Thank you. Thank you, Joe. In 2016, I was elected primarily to make sure that every single Georgian had access to quality health care and that no one died because they didn't have quality health care. Since my time working down here, I've seen one thing that is absolutely clear. The Republicans have no plan to insure Americans and make sure everyone can receive life-saving access to quality health care. There is absolutely zero plan. And in fact, just the opposite. The Republicans' plan is to eliminate protections for people with pre-existing conditions, to stop the expansion of access to health care, and to not bridge the Medicaid gap. We're turning down $1 billion per year in Georgia that could save lives all across our states and shore up rural communities. This lawsuit is a partisan attempt to do what the Republicans couldn't do in Congress. I've heard a lot of talk these days about a coup or usurping an elected majority's decision. Well, I know the Affordable Care Act is the decision of an elected majority, and the Republicans have never won enough elections to repeal the Affordable Care Act. So instead, they've gone the route of a partisan lawsuit, and they have Republican appointees on courts who, even though they say they follow the Constitution, have disregarded prior precedent that would clearly keep the Affordable Care Act in place, including the Republican-dominated United States Supreme Court's precedent on this. We have rogue actors working with rogue attorney generals. Our own attorney general right here is literally fighting every day to strip health care from millions of Georgians, including 4.3 million people in Georgia that have pre-existing conditions. We have to stand up and do everything we can to stop this. But first, let's call out what this process has been like. They have disregarded the will of the people and the voters that installed the Affordable Care Act. They've failed to repeal it in Congress, and instead they've gone on a partisan lawsuit to strip health care from millions and millions of people around the state, including potentially over 4 million Georgians.
Thanks, Representative. Next up is Stacey Fox. Stacey is the president and CEO of Planned Parenthood Southeast. It's a nonprofit organization that provides vital reproductive health care, sex education, and information to the people of Georgia, Alabama, and Mississippi. Stacey has been a leader in this field for more than 20 years.
Thank you, Joe. As Joe said, my name is Stacey Fox, and I'm the president and CEO of Planned Parenthood Southeast Advocates. Let's be clear, the timing of this decision is not coincidental. As our representatives in Washington prepare to turn impeachment proceedings over to the Senate, two Republican-appointed federal judges delivered a devastating blow to the Affordable Care Act and access to health care in this country yesterday. And it is not lost on me that here in Georgia, a federal judge is preparing to weigh in on the rampant voter suppression in our state later today. Let's be clear, this is all tied to voter suppression. When voting rights are under attack, those in power, whether in Washington or right here under this gold dome, can make unilateral decisions that go against the will of the people. Here in Georgia, we are experiencing a health crisis. We have the worst rates of maternal mortality in the country. 750,000 Georgian women desperately need access to publicly funded contraception, and over half of our counties in Georgia have no OBGYN at all. And instead of working to expand access to health care locally or nationally, lawmakers are working overtime to dismantle what little access to health care exists. Georgia lawmakers continually refuse to expand Medicaid under the ACA, so we here in Georgia are living proof of what a world without the ACA looks like. This decision will have life or death consequences for countless Americans. Make no mistake, our lawmakers are nervous, and they should be. From the sweeping abortion bans we saw this spring to the repeated attacks on access to affordable health care and insurance, they have made dangerous political decisions that will affect our lives for generations to come. But it is a direct result of those decisions that we are fired up more than ever. We now realize the courts can't and won't protect us from these political attacks. Our constitutional rights are under attack across the board. And what we said this spring still holds true. We are coming for their seats from the top of the ticket all the way down, and we will vote out these lawmakers next fall who are willing to play politics with the lives of Americans. Thank you.
Thank you, Stacy. Next up is Dr. Michelle Au. She is an anesthesiologist who's been in practice for 16 years. She's affiliated with Emory St. Joseph's, and she received her degree from Columbia University College of Physicians and Surgeons, and she holds a master's in public health. Dr. Au, that's AU.
Thank you so much. So, as a doctor, my life's work is taking care of not only patients, but of the communities that we serve. This morning, I want to tell you the story of one patient who deserved better than what, despite our best efforts, we were able to provide her. So years ago, I was on call overnight when we got word of a critically ill patient who was being transported in by medical helicopter from a small rural hospital in North Georgia. This was a young patient, previously thought to be healthy, who woke up that morning with tearing chest pain. The patient did not have health insurance, was concerned about her out-of-pocket medical expenses, so she took some antacids and went back to bed. More scared about the cost of her care than the severity of her symptoms, she waited and waited and waited. She waited until she was so sick that the small regional medical center closest to her, still a long drive away, was unable to treat her condition. And now, critically ill, literally hours from death, she was being transported by air to my tertiary care hospital in Atlanta. The patient had what's known as an aortic dissection, which is a condition where the inner layer of the body's largest organ shears away from the outer wall. It has one of the highest mortality rates of any surgical emergency we encounter. She was a young patient, a woman, a mom, and we worked on her desperately, operating throughout the night, cracking open her chest, pouring blood into her body as she hemorrhaged on the table, shocking her heart once, twice when it stopped beating. We brought her up to the ICU after 8 hours of surgery and watched as her family sat by her bedside, wondering if she would ever wake up. None of this had to happen. This patient's primary risk factor for her aortic dissection was garden variety high blood pressure. High blood pressure, which could have been caught at an annual physical, treated with standard medication, and managed with regular preventative care. Because this patient was granted none of these points of access, her interface with the medical system was catastrophic and nearly cost her her life. There's a mistaken presumption that eliminating health care coverage for more Americans is cheaper. And I can tell you for a fact that it is not. The cost of avoiding essential health services is, in fact, astronomical. There's a cost to the patient in terms of physical harm and disability. There's a harm to the community in the form of lost productivity and wages. And there's a cost to the medical system, which has to absorb billions of dollars in uncompensated care. This was one catastrophic story. With the repeal of the Affordable Care Act, stories like this would become increasingly more common. For our state, the impact of overturning the ACA would include more than 400,000 Georgians losing their coverage, causing nearly a 30% increase in the uninsured population, just like this patient we saw. A loss of key support for our already underfunded and understaffed rural hospitals, just like the one the patient went to the first time, leaving Georgia hospitals on the hook for an additional $1.2 billion in uncompensated care costs. Also, more than 4.1 million Georgians would once again have to pay for basic preventative care, such as annual physicals, flu shots, mammograms, and other essential health benefits. The Hippocratic oath we take as doctors tell us to first do no harm. Stripping the protections of the Affordable Care Act threatens to harm our patients and our communities and threatens my ability to take care of them in the best way I know how. We have the most advanced healthcare system in the world. No one in this country should be dying because of a lack of access to blood pressure medication or insulin or prenatal care. No one in this country should be dying because of a Republican healthcare plan which aims to strip them of their essential rights. First, do no harm and vow to protect the patients and families my colleagues and I have dedicated our lives to serve. Thank you.
Thank you, Dr. Howe. If you pay any attention at all to this issue, you'll hear more and more stories just like that. And here to tell us a little bit about her own personal experience is Janelle Green. She is a breast cancer survivor. She was diagnosed in 2013. She's also the executive director of a nonprofit affordable housing retirement community, Cathedral Towers, as well as the executive director of the Georgia Alliance for Social Justice.
Good morning. As a breast cancer survivor and the wife of a man with end-stage renal disease, this is personal. I came here today from my oncologist's office to learn I need more tests. And I need to know that the Affordable Care Act will be here for me and for my family. Yesterday was a dark, dark day for our country. Not only has our nation fallen into the hands of a corrupt administration seeking to steal elections, a terrible thing happened in the courts affecting us all. This court, hiding behind the national attention of the impeachment, made a decision that threatens the lives and well-being of all of us. While the Affordable Care Act may not be perfect, and it has given us all tremendous protections and benefits. As a cancer survivor and a wife of a man with end-stage renal disease, our lives literally depend upon the Affordable Care Act. Whether it's guaranteed coverage or protection from discrimination due to our pre-existing conditions, we rely upon this for our very lives. Last night, along with all of you, I watched and listened as countless Republicans stated over and over again about our tremendous economy. They brag that we are in an unprecedented economic time that benefits us all. But if times are so good, why do they continue to refuse to provide health care and health care guarantees for all Americans? If times are so good, why do they cut food stamps and other life-sustaining programs to care for our communities? Whether you are a person of faith or simply a person of good conscience, we are called upon to care for our community. And caring for a community is in one of the most prosperous nations in the world means that ensuring that all people have access to quality, affordable health care. We will all face some sort of health care crisis in our lives, whether it is ourselves, our spouses, our children. We all rely upon the affordable access to health care. So I'm here today to not only denounce the decision of this court, but to implore Congress to take action now. You must take action. You must use that prosperity of our nation for the greater good. You must ensure that the nation with the greatest hospitals, doctors, and healthcare resources are available to all Americans. We cannot continue down this road as a two-class system. Those who have access to affordable health care and those who must rely exclusively upon emergency rooms because they cannot afford to have insurance, or like me, they may have a pre-existing condition, so that the cost to them will become out of reach. So if we are truly a nation of good faith and good conscience, we must act now to ensure that all Americans have the care that they need. Thank you.
Powerful testimony. Thank you, Janelle Green. Thanks, everybody, for sharing your stories. It's no mistake, this lawsuit is the Republican health care plan. There's no replacement that's been mentioned. The lawsuit was the plan in total. Overturning our health care law means 461,000 Georgians could lose their coverage. 4.3 million Georgians with pre-existing conditions will be left at the mercy of insurers. That concludes the conference. These folks will be available to answer questions if you're interested. Thank you very much.